via the vertebral arteries and the internal carotid artery. We've sent the blood into the brain tissue, bring it back out again, and we have the middle cerebral vein and we have the posterior cerebral vein, but we don't have an internal carotid vein. Anybody know what we have instead? The jugular, the internal jugular vein. And that is not at the carotid canal, that's at the jugular foramen. So let's see how we get the blood from the surface of the brain back to the internal jugular vein. All right, so we're going to go back to these folds of dura mater. Yes?
You said that there were 3 connecting vessels.
Yes, 2 posterior communicating and a single anterior.
So each one is common. Okay, got it.
Not 3 sets.
Okay.
Okay? Can I erase this picture here of the circle of Willis? Okay. I'll leave this dura mater up there because we're going to come back and look at that again. All right, so now let's look at a coronal section of the brain. All right? A coronal section of the brain is cutting the brain as if it was a loaf of bread. So this would be a sagittal section. A coronal section would be this way. Okay, we have a whole series of them back there on the shelf that we'll be looking at over the next few days. Pardon? Yeah, and that's a plate as a coronal suture. Yeah. So here would be that one hemisphere. These are the folds of brain that we'll be talking about next week. All right, so we'll put the pia mater was blue, right? Yeah. So there would be pia mater. And dura mater, arachnoid mater. With our spidery lines. And then the dura mater. And notice the dura mater up here at the top, right over this gap, splits. And then comes down into that space. And that's what you're seeing right here. Okay? So that split creates a channel. If we were to look at that a little bit larger, we would see this. Okay? So, I'm going to draw it actually right here. So here's the outer layer of the dura mater. Here is the split. And that creates a dural venous sinus. It's not really a blood vessel because it doesn't have smooth muscle. It's not lined with simple squamous epithelium. Here is the arachnoid mater. And the arachnoid mater along the sinus bulges into it. And where it bulges into it, it is known as an arachnoid villus or an arachnoid granulation. In addition to that, we have the pia mater, and in the pia mater we have veins, and those veins will empty into the sinus. What you're seeing here. So the posterior cerebral veins and middle cerebral veins that are traveling back on the surface of the brain now will take their blood flow and empty it into these split spaces between the dural folds and get carried back to the jugular vein through these sinuses. The CSF from the subarachnoid space is going to get into the same sinus by crossing the arachnoid villi. All right, but right now we're looking at the blood flow. So these would be cerebral veins. So this is identified as the superior sagittal sinus. And this is the inferior. Sinus. This would be superior sagittal sinus again, just a larger diagram. Yes.
So we're focused on blood, but you said that there's also the
CSF is going to empty into the same pathway.
mixes.
Mm-hmm. Yeah, so the sinus is containing a mixture of blood and CSF. Okay? So here, remember the dura mater, the falx cerebri, and tentorium cerebelli? If I were to draw the superior sagittal sinus onto this fold, it would be located right here. All right, that would be the superior sagittal sinus. The inferior sagittal sinus is not as complete, and it's along the inferior edge here. Sagittal meaning it's in the midline. And then the inferior sagittal sinus is going to flow through the transverse sinus right here. So here would be superior sagittal sinus. Here is inferior sagittal sinus, and then it's going to flow through the through the straight sinus to the transverse sinus. So here's the transverse. And I'll write out these vessels in sequence for the flow pathway back to the jugular foramen for you. So flow of the fluid through the inferior sagittal sinus goes next into the straight sinus, and then it can go left or right as it joins fluid from the superior sagittal sinus. And that's the transverse sinus. Okay. So if we look back at this diagram that I made, this would be superior, this would be inferior sagittal, and here would be the straight. And then it can go through the tentorium cerebelli up to the edges that way. Okay? So those two curving left or right would be the transverse sinus. Now, our jugular foramina are down here. And so there's a curved groove that it travels through to get to the jugular foramen. And what's the Greek letter S? Do you know? The Greek letter S? Sigma. So these are called the sigmoid sinuses. So let me show you some images again, and then we'll write them on the board in sequence. So CSF and venous blood can travel through the superior sagittal sinus, out the transverse sinus, and down the sigmoid sinus, and be at the jugular foramen, flowing into the internal jugular vein. Or they can flow from the inferior sagittal sinus, down the straight sinus, and then into the transverse sinus. So our next image here, again, shows you, let me move it up so those of you in the back can see the sigmoid sinus is a little bit better. So here's the straight sinus. This is the tentorium cerebelli. You go left, go right or left through the transverse sinus, and then go down into the sigmoid sinus, and right there it flows into the jugular vein, the internal jugular vein. Again, when lab starts, I'll get a couple of the models out of the other room. On this teaching skull here, the location of the superior sagittal sinus is painted here in blue. All right, this inferior sagittal sinus we can't see because that's going to be in this space right here. And then you can see the transverse sinus would form a groove as it bulges into the bone when the bone was still soft and not mineralized, and then there would be the groove. You can actually feel the groove for the sigmoid sinus, and it leads right to the jugular vein, the internal jugular vein. Okay, double S curvature, leading right to the jugular foramen. So can I erase this picture now? So if we write in sequence, all right, so the blood flow from the superior sagittal sinus and this would be venous blood plus the cerebrospinal fluid. Go into the superior sagittal sinus. From the superior sagittal sinus to the transverse sinus. All right, superior sagittal sinus to transverse sinus to sigmoid sinus. From the sigmoid sinus to the internal jugular vein, and on to the heart. Now, if it's in the inferior sagittal sinus, what's the next sinus it's going to go into? Straight sinus. And then that will go into the transverse sinus and then continue down the same pathway. Now, if we look at this view right here, there are additional sinuses up around the trigeminal nerves and up front that you don't have to worry about, okay? They do, so you can see sinuses here leading back from the eyeball and through the nasal cavity into this region that would lead back there. So there's this area called the danger triangle around the nose and upper lip where the veins lead back towards the brain and don't have any valves. So it's a pressure flow. And so it's the danger area because you don't want to be popping any pimples in that area. You can push bacteria into the blood flow, and with the higher pressure of trying to pop it, push it back actually into brain tissue and start a brain infection. So pop them down here, so don't pop them in this area. All right, so now let's finish up lecture by looking at the flow of